Hey everyone, and welcome. We've all had a simple cut on our finger, and we just watch it heal without giving it a second thought. But have you ever really stopped to think about the incredible science that's happening under that band-aid? Well, today we're going to peel back that band-aid, metaphorically of course, and dive into the super complex, high-tech world of wound management.
Okay, let's just jump right in with a number that is, honestly, it's pretty shocking. 500,000. On any given day in Australia, that's how many people are walking around with a wound that just won't heal. This isn't just a few scrapes and bruises. We're talking about a massive and mostly hidden public health issue. And as you can imagine, that human cost comes with a huge price tag. $3 billion. That's what these wounds cost the Australian economy every single year. From the direct medical bills to things like people not being able to work. It just goes to show how incredibly important it is to get healing right.
So this gets you wondering, right? Why does a paper cut on your finger heal in a couple of days, but other wounds can just linger for months or even years? This is really where the story begins, understanding what happens when that amazing natural process just gets stuck in a rut.
In the medical world, there's actually a pretty clear line. They call it a chronic wound. And the definition is simple. It's any regular or acute wound that hasn't healed up properly after 6 weeks. That 6-week mark is like a big red flag, telling doctors that something has gone seriously wrong with the healing process.
So think of it like a fork in the road for any injury. On one path, you have your acute wounds, the usual suspects: burns, scrapes, surgical cuts. Our bodies know exactly what to do with them. But then there's the other path, the chronic wounds. Here, the healing process stalls out completely. It fails to progress. These are things like venous ulcers or pressure injuries. They are, quite literally, stuck.
Okay, so if a wound is stuck, how do you get it moving again? Well, you can't just slap a dressing on and cross your fingers. No way. Before they even think about treatment, clinicians have to basically become detectives. They have to decode not just the wound itself, but everything about the patient to figure out what's really going on.
And the list of potential culprits is huge. You've got intrinsic factors, stuff happening inside the body. Things like the patient's age, whether they have diabetes, or even just poor nutrition can all slam the brakes on healing. Then you have extrinsic factors, things from the outside, like an infection taking hold or even simple physical pressure on the wound. All of it can stop healing dead in its tracks. So to cut through all that complexity, clinicians use some really clever tools. One of the go-tos is the time framework. It's a super simple but really powerful way to assess a wound. So T is for tissue. Is the tissue in there healthy or is it dead? I is for infection. Are there nasty bacteria getting in the way? M is for moisture. Is it a swamp or is it a desert? It needs to be just right. And finally, E is for edge. Are the new skin cells at the edge actually moving in to close the gap? It's an amazing little 4-step checklist. Right, so once the detective work is done, it's time to open up the toolkit. And let me tell you, we have moved way beyond the gauze pads and sticky tape you have in your bathroom. We are now in the age of smart dressings that are active players in the healing game. This is where it gets really cool.
It's really a massive shift in thinking. The old school way was totally passive. You just cover the wound with something inert, like gauze, to keep it clean. But the new school is completely different. It's interactive. These new bioactive dressings don't just sit there. They actually change the environment inside the wound to create the absolute perfect conditions for the body to do its job.
So what's in this new toolkit? Well, let's say a wound is producing way too much fluid. It's too wet. For that, you've got dressings like special foams or alginates. They're basically like little high-tech super sponges, designed to soak up all that excess moisture and keep the surrounding skin from getting damaged. But what if you have the opposite problem? A wound that's as dry as a desert can't heal either. No problem. For that, clinicians pull out hydrogels. These amazing dressings are designed to actually donate moisture to the wound, rehydrating it to create that perfect, slightly damp environment that cells absolutely love. And then, maybe the most impressive of all, you've got dressings that are active soldiers in the fight against infection. Remember the I and the TIME framework? If bacteria are causing the problem, you can use a dressing that's actually infused with things like silver or iodine. They don't just block germs, they actively attack and reduce the number of bacteria in the wound. How cool is that?
So we've got this amazing high-tech toolkit, dressings that can absorb, hydrate, fight infection. We can basically dial in the perfect environment.
But, and this is probably the most important but in all of medicine, even the smartest dressing in the world is totally useless if you're ignoring the real problem. Because here's the thing, a chronic wound is almost never just a skin problem. It's a big flashing warning sign of a much deeper issue. A venous leg ulcer? It's not going to heal unless you use compression to fix the underlying vein problem. A diabetic foot ulcer? It needs you to get blood sugar under control and take the pressure off that spot. The wound isn't the disease, it's the symptom.
Which brings us to the big question. After all this science, all this technology, what is the single number one most important rule of wound care?
And here it is. This quote from wound care expert Jeffrey Sussman absolutely nails it. A dressing manages the wound environment, not the cause. It's so simple, but so profound, that high-tech dressing is just a tool. A very important tool for sure, but it doesn't fix the reason the wound is there in the first place.
And that's the real takeaway here. The most crucial point of all is that true healing only happens when we treat the whole person, not just the hole in the person. It's about looking past the wound to fix the underlying condition. That's when the magic really happens. So I'll leave you with a final thought. The next time you see a simple Band-Aid, I hope you'll see something more. You'll see the tip of an incredible scientific iceberg, a whole world of detective work and high-tech tools dedicated to helping our bodies do what they do best, heal. Thanks for joining me.